Welcome to the ATHENA trial. I'm Sian Wells, Trial Manager on ATHENA, amitriptyline for the prevention of post-hepatic neuralgia. This module is designed for clinicians who will be screening patients for participation in the trial and confirming eligibility for those who are interested. In this brief presentation, I'm going to remind you of the aim of the study and then talk you through how to identify and refer eligible patients. Before we start, we should remind ourselves of the importance of good clinical practice, or GCP. GCP is an international ethical and scientific quality standard for the design, conduct, performance, monitoring, auditing, recording, analysis and reporting of clinical trials. This trial is being conducted in accordance with GCP to ensure that clinical research participants are not exposed to undue risk and that data generated from the research are valid and accurate. Completing this module so you are trained to perform your role in the trial is one of the ways of ensuring that you are compliant with GCP. The study has several objectives, but the main one is to compare the clinical effectiveness of low-dose amitriptyline to placebo for the prevention of post-hepatic neuralgia at 90 days. We will do this by randomising 846 adults with newly diagnosed herpes zoster, shingles, to take amitriptyline or placebo for 70 days. The early administration of antivirals reduces the acute pain of shingles, but has never been shown to reduce the prevalence of post-hepatic neuralgia, the most common complication of shingles. However, a previous, small and methodologically limited trial suggested that prophylactic amitriptyline may reduce the prevalence by 45%. Your role in the patient recruitment pathway is highlighted here in red. Referral of potentially eligible patients will be supported by a pop-up, running medical record searches 2 to 3 times per week, or a combination of both of these. From the pop-up, you can give the patient a copy of the study summary and complete the online screening form. It's important that the screening form is completed even if the patient is not interested or eligible, as this forms the study screening log. Thereafter, all steps in blue are completed by the study team. Please note that you are only being asked to confirm interest and eligibility, not undertake consent or prescribe. As a referring clinician, you will be signing off the patient's eligibility, which will form the basis for recruitment into the trial and the prescribing of amitriptyline or placebo. Therefore, it is essential that the inclusion and exclusion criteria are completed accurately. To be eligible, patients must be 50 years or older, with a clinical diagnosis of herpes zoster, presenting less than 144 hours after rash onset. Exclusion criteria are more extensive, but essentially can be divided into those specific to the trial and those related to the safe use of amitriptyline. You do not need to memorise these, they are listed on the online screening and referral form. The exclusion criteria specific to the trial are listed in the green boxes. 3rd or more episode of herpes zoster, unable to give consent and complete questionnaires, current or recent participation in a controlled trial of an investigational medicinal product, and immunosuppression. The criteria related to safe use of amitriptyline are based on those listed in the British National Formulary and are given in the other coloured boxes. A good question to help you navigate these is, in normal clinical practice, would I be willing to prescribe amitriptyline 30 mg to this patient? More details, including definitions of immunosuppression, are listed on the screening and referral form, in the study protocol, and also on the study website. If your site is using the pop-up, when you enter a relevant diagnostic code in a patient 50 years or older, the pop-up will activate. This is shown on the left of the slide. A form of words is suggested for you to introduce the patient to the study. Some people can get persistent pain long after the shingles rash has gone. We are recruiting patients like you to a study being run by the university. Would you be interested in hearing more? This and other instructions are shown in the centre of the slide. Click the link to open the patient summary sheet and share it with the patient by either printing it off or by texting or emailing it to them. A copy of the summary is shown on the right-hand side of the slide. Next, you will click the link to open the screening and referral form. If your site has chosen to use the search, either alongside the pop-up or as a standalone tool, we recommend it is run at least 2 to 3 times per week. This is because patients must be referred within 6 days of rash onset. When the search has identified a potential patient, the screening and referral form can be opened in one of 2 ways. If you have the pop-up installed, enter a shingles code in the patient's record, and this will trigger the pop-up to open. From here you can access the patient summary and the screening and referral form. For sites that do not have the pop-up installed, a PDF will be provided containing the link to the patient summary and the screening form. Following the link to the screening and referral form will open a window in your internet browser. Please fill in the form, even if the patient is either not eligible or not interested, as this non-identifiable information forms our screening log. You can now close the pop-up, allowing you to check the patient's record for eligibility criteria. If the patient is not interested, but is willing to speak to a qualitative researcher briefly about why not, please enter the patient's contact details. Please work your way through the study inclusion and exclusion criteria. Although the list of exclusion criteria is long, remember they will not apply to the majority of patients, and so the answers will be no. If the patient meets all the eligibility criteria, you will be asked if the patient is willing for their contact details to be shared with the study team, as well as for their shingles vaccination status, the named dose of antiviral prescribed, and the average shingles-related pain in the past 24 hours. You will be asked for your name and to electronically sign the form before being taken to the next page, where you are presented with a PDF copy of the data for you to verify. Please ensure that you press Submit at this stage to take you to the Thank You screen. Otherwise, your data will not be received by the research team. It is important to highlight that only clinicians that have watched these training slides and completed the delegation log are able to refer patients. If other members of your team, such as non-ATHENA trained clinicians, see a patient with shingles, they will not be able to sign off the eligibility and refer the patient. Instead, they should check the patient's interest and pass their details on to yourself or another ATHENA trained clinician to refer as soon as possible. To bring the referral form up, enter a shingles code into the patient's medical record to trigger the pop-up again. Equally, if you are unable to complete the whole referral process during a consultation slot with a patient, we ask that you give the patient summary sheet to the patient, check their interest, and then you can complete the form later that day as soon as you are able. After you have submitted the GP screening and referral form, please close the browser window and tell the patient to expect a call from the research nurse in the next 24 hours. The online referral will be picked up by a trained research nurse who will send them a full information leaflet and arrange a consent appointment. If consent is received, the patient will be randomised to control, placebo, or intervention, amitriptyline 10 mg, up titrated over 2 weeks to 3 tablets daily for 10 weeks. You do not have to prescribe the study medication. This will be done by clinical members of the research team, who will do so based on the information that you give. It will be posted directly to the participant, unless by arrangement they would prefer to have it delivered to your surgery and collect it from there. Patients who give consent will be randomised, and a letter confirming this will be sent to your practice along with a copy of their consent form. This should be added to their electronic medical record along with trial participant code with the ATHENA CPMS ID, a note on their medication screen to say that they may be taking amitriptyline for up to 3 months from the date of randomization. Usual care is otherwise unaffected. You are free to prescribe any medication as required, as long as there are no contraindications to amitriptyline, but you cannot prescribe amitriptyline itself. If there are any safety concerns or problems for a patient that cannot be answered by the research team, there is an optional GP review appointment for participants around 28 days post-randomization. If you become aware of any adverse events within 12 months of recruitment, please inform the study team at the earliest opportunity. Adverse events are defined as any untoward medical occurrence in a study participant, including occurrences which are not necessarily caused by or related to the study medication. Thank you very much for supporting our study and for watching this training module. You must now complete the MS Forms ATHENA training log to confirm completion of the module. Please let your practice research lead know so they can share the delegation log with you for you to add your name and signature to the list of clinicians able to screen and refer patients into the study. If you have any questions not answered by this module or the study protocol, please contact us using the study mailbox, ensuring you include your practice name and CRN area in the subject heading. You can find out more information and follow study progress via the study website or our Twitter account.